Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is November 1st, 2022. Thank you for joining us. There seems to be some kind of technical issue on the Facebook server side, so we're not able to stream live on Facebook for whatever reason. We are streaming live on Twitter, and we will keep the recording, so if people want to watch later, they can. So apologies if you're looking at this later and had some trouble finding us, but it does seem to be an issue on the Facebook side. Let's go ahead and dive in though. So as always, this is your chance to get your COVID questions, your infectious disease questions, your other public health questions answered live. We will start with our local data. You can put your questions directly into the box below if we get Facebook back up, or use the hashtag AskDrArwady on either Facebook or Twitter. So we'll pull up chi.gov/COVID- and look at the COVID dashboard. So really, all of our COVID numbers are heading the wrong direction. That is not a surprise given that we are heading into now November. This is when we traditionally start to see the respiratory virus surge that comes as we move inside, head into late fall and winter. But you can see that cases, and again, that means lab confirmed cases, people who are being diagnosed in a hospital setting, a pharmacy setting, a laboratory setting, a doctor's office setting, those are up again this week to 407 average daily. This, of course, does not include the hundreds of people who are being diagnosed every day through at-home tests. Hospitalizations are also just up a bit. You can see we're currently averaging 25 Chicagoans being newly hospitalized every day with COVID-19, up 11% from a week ago. And you can see in the graph here, for any of these, you're welcome to click on and explore yourself. You can see that this is just starting to come back up. So we're keeping an eye on it. The risk overall is still low, but slowly heading the wrong direction. Deaths were averaging 0.57 a day. So you can see last week, 1.29 per day over the week would be, that's probably 9 Chicagoans who died of COVID last week. Vaccinations, we continue to be in the 5,500 or so vaccinations administered across Chicago every day. Most of those are the fall 2022 COVID booster, and that is the most important thing that we want people doing to get us ahead of the likely surge coming this fall and winter. Emergency room visits, just 1.5% of all of the visits of people coming into emergency departments across the city are for what turn out to be COVID. And then just over 3%, 3.3%. So that's one in about, 30 or so of our hospital beds right now across Chicago hospitals are taken up with people with a COVID diagnosis. So you can explore further anywhere here, but let's go ahead and look at some of our other data in some more detail. So first of all, let's do a quick look at monkeypox. I want to note, if you've been following along, all of this data is available on chicago.gov/monkeypox or chicago.gov/MPV. We update this Monday, Tuesday, Wednesday, Thursday, Friday, just like we did the COVID data. You can see that the number of new cases continues to be relatively low. It's in relatively good control, but it's definitely not gone, still circulating. We're at nearly 1,100 MPV cases diagnosed in Chicago residents. 70 of those individuals have needed to be hospitalized. And I do want to note that we have had a third monkeypox death in a Chicago resident. We reported the first 2 last week and now a third this week. All of those individuals had other conditions, were immunocompromised, and none of these were new infections. These were all people who were diagnosed with MPV weeks to months ago and had been hospitalized for some time. But it really underscores the importance of people getting vaccinated, especially if they are immunocompromised or have other conditions. Those 3 deaths now in Chicago residents are 3 of the fewer than 10 total that have occurred across the U.S. from MPV. So thankfully, it remains very unusual for people to die from MPV. So that's fewer than 10 total deaths out of nearly 30,000 cases in the U.S. and fewer than 40 deaths globally out of nearly 77,000 cases. So just want to recognize that increase this week. Also, just want to remind folks that MPV vaccine eligibility has widened and there is plenty of availability. So anyone who had skin-to-skin or intimate contact with someone diagnosed with MPV needs to get vaccinated. Anyone who lives with HIV, anyone who is eligible for or currently taking PrEP, which is pre-exposure prophylaxis to help prevent infection with HIV, anyone who exchanges goods or services for sex. All of those folks really should get 2 doses of the MPV vaccine. But also, eligibility has expanded just given that this is not going anywhere. We expect it's going to consistently be something to be screened for, and that nearly all of the cases still have been in sexually active gay, bisexual, and other same gender loving men. We have expanded the recommendation for vaccination to all sexually active gay, bisexual, and other same gender loving men, and all sexually active transgender individuals. And then finally, anyone who is a sexual partner of any of the categories included above. So if you or someone you love meets this list, you should get 2 doses of the MPV vaccine. And you can go to chicago.gov/MPV to learn how to do that. If you have any questions, there is treatment available for MPV, there is vaccine available, and there are things that you can do to protect yourself even after vaccination. So turning to COVID, we did a Halloween-focused press conference last week. I dressed up as a wizard with a crystal ball, given that people are always asking me to predict the future related to COVID-19. But I want to wish you a happy Halloween. Hope you had a good evening last week. But really, we don't want to let COVID haunt you. And getting the new fall 2022 COVID bivalent booster is critical to be protected heading into this fall and winter. I want to highlight that when we look at the global map here, darker means more cases, and you can see that Europe is back really at a higher level of new COVID-19 cases per population. I also want to highlight that 12.8 billion COVID vaccine doses have been administered around the world. It's really remarkable. This vaccine is safe and it is effective, especially at preventing severe illness. The last week, just to give you a sense of what has been changing in terms of COVID, last week, 1% of U.S. counties were reporting being at that high COVID community level where really you should have a mask on indoors. Hospitals are getting pretty full. You can see there were 3 counties in Illinois that were at that higher COVID community level. And then 18% of U.S. counties were at a medium level. Most, including Chicago and Cook, have been at that green lower level, which makes me very happy. That's where I'd love to stay. But you can see that as we moved into this week, 2% of U.S. counties now were at a high COVID community level. That does include 5 Illinois counties, and you can see the others scattered. And then 22%, almost 1 in 4, were already up to a medium level. I do anticipate that in the weeks to come, Chicago, Cook County, likely will move back to a medium COVID level, just based on what we're seeing around the country and the uptick in cases and especially hospitalizations. The other COVID indicators still look good. We're at a low level of concern for emergency department encounters. We're at a low level of concern for our wastewater sampling, and we're at a low level of concern for variant risk. I'll show you the details on that. So COVID is not top of mind, but it is also very much not over. And as I highlighted at the press conference on Friday, and then I updated today, we've had 7,914 Chicagoans die from COVID-19. You can see that after the first surge, when it hit us in March and April, the 2 surges prior to this have both been in the winter. You can see the winter of 2020 to 2021. We had a big peak of deaths and hospitalizations and cases then. And then last winter, we had a big peak. This is deaths, but same thing for cases and hospitalizations then. And so you can see that really since coming down that peak through 2022, things have been in relatively good control. We've moved between a medium and a low COVID level. Deaths have been not nothing, but they've been lower, you can see, than they were in 2020 or 2021. But the concern is heading into winter. I don't want to see a major spike at all, and ensuring people are up to date with their vaccines is the most critical thing. So among those more than 7,900 COVID deaths, I just wanted to highlight that since the pandemic began, COVID has been the second leading cause of death after heart disease in Chicago. And even now, we're seeing 5 to 7 Chicagoans die of COVID every week. Across the U.S., we're seeing still 300 to 500 Americans die of COVID every day, which means at that rate, somewhere in the vicinity of 150,000 Americans dying each year of COVID-19. Similarly, on the hospitalization front, we've had more than 48,000 COVID-19 hospitalizations in Chicago. Even now, 15 to 25 people are being newly hospitalized every day with COVID in Chicago. And you can see again on this graph here that there was that initial surge in hospitalizations, but then the two other big surges were the winters, the winter of 2020 to 21 and the winter of 21 to 2022. And last winter, 21 to 2022, when Omicron first hit, was, you can see, actually the worst year we had for hospitalizations at any point in this pandemic. And so again, from a crystal ball standpoint, I do think we'll see at least some surge in COVID cases, hospitalizations, and deaths. My hope is that that will stay very low and not like what we saw in the winter of 2020 or the winter of 2021. And I do want to highlight that the little tick that we're seeing right now in terms of increases in COVID hospitalizations is falling on unvaccinated Chicagoans again. You've seen me show these graphs almost every week. They are available on our dashboard, but this is just Chicago data. The red line shows you hospitalization rates in unvaccinated Chicagoans. The light blue line shows COVID hospitalization rates in Chicagoans who got their initial COVID vaccines but are not boosted, and then the dark blue are Chicagoans who got their initial vaccine but then have stayed up to date with boosters. And you can see that even if you look at last January, we did see a slight increase even in that dark blue line for people being hospitalized even where they were up to date. But in the light blue line on the left there, much more likely if you were not boosted, and then dramatically more likely still if you were not vaccinated. And this is regardless of whether you've had COVID before. It is purely based on vaccination rates. And on the right side of the graph, that's October, and we are again starting to see an increase in COVID hospitalizations, specifically in that red line in unvaccinated Chicago. And so if you or someone you love is one of the people who never had a COVID vaccine, I want to just highlight that you can start now. That's not a problem. We'd actually love to get more people started on COVID vaccines. They are available, they are free, they are safe. And my goal is just to help keep you out of the hospital. So we also, and we got some questions in about this, have seen a surge in child respiratory illnesses and especially hospitalizations. Not necessarily from COVID, at least not yet, but from other respiratory viruses, especially one called RSV, which is respiratory syncytial virus. So this shows from early 2021 to the present, the light blue line are Chicago hospitalizations for children being admitted with respiratory or lung problems. And you can see that a year ago we did have some increase, but right now we've got the highest number of respiratory child hospitalizations that we've seen in total, like over the last few years, really breaking some records there. Our pediatric ICU capacity is especially stretched, and you can see most of that is from that purple line, that RSV, respiratory syncytial virus. The red and the black show influenza, flu, and then COVID hospitalizations, and we're just starting to see influenza hit Chicago. And I do expect, my worry is that with RSV already as high as it is in hospitalizations, if we add the likely increase that we'll see with COVID and with influenza, like we've seen in prior winters, that's going to really be a problem. We don't have a routine RSV vaccine, but we do, of course, have vaccines for children aged 6 months and up for both flu and COVID, and we really want to encourage people to get it. There's been this attention on the triple-demic, and yes, it is possible to have RSV and flu at the same time, or flu and COVID at the same time, or even in theory, RSV and flu and COVID at the same time. But even if those are not all happening in one child at the same time, they are absolutely hitting our hospitals hard. If right now you go into a children's hospital, the emergency departments are very full, and many children are needing to stay a long time down in the emergency department waiting for beds to open up. So just if you have a young child, please make sure they're up to date with all of their vaccines, and that includes flu and COVID, because I am pretty concerned heading into this fall and winter. Let's talk a little more about variants, which I know you all are, those of you who watch continuously watch this closely. So you'll see that, again, just as a reminder, every one of these bar graphs is a week. This goes from the end of July until this most recent week. And you can see, I like it best when we see big bars of one type of variant. So that turquoise, that BA5, has been our predominant variant for a long time now. That you can see that each week now, again, as we're seeing more infections, as we're heading into fall and winter, we're seeing more Omicron subvariants emerge and outcompete BA5. Importantly, they are all still Omicron. Let me emphasize that. They are all still Omicron. The WHO met just a week or so ago to decide, are any of these subvariants different enough from Omicron that we have to start thinking about naming a new variant of concern? And the decision was no. That's good news, because it means that when people get their updated COVID vaccine, they should have some protection, some increased protection against BA4, BA5, these other subvariants. But it does mean that the virus continues to mutate, and we're watching all this really closely for what we call immune escape. So that's where we are right now with variants. And similarly across the US, you can see whereas almost everything was that one turquoise color, we're seeing these other colors all emerge. And it's another point of concern, honestly, heading into the winter. So just as a final kind of point here, do you think you're up to date with your COVID vaccines? If you have not been vaccinated since Labor Day with a COVID-19 vaccine, it's time for almost everybody. Previously vaccinated Chicagoans age 5 and up are eligible for the new fall 2022 bivalent booster, which gives the best protection against Omicron. How are we doing? So we have administered more than 273,000 doses. You can see this shows, since the vaccine became available after Labor Day, how many doses are being given each day in Chicago. You can see on the weekdays, we're generally doing 6,000, 7,000, and then on the weekends, more like 3,000. So the overall is still at around 5,800 or 6,000 a day. I've been pleased that that red line, which is the 7-day rolling average, that's been relatively steady. So we see people every day making that decision. But this is not enough in terms of the people who have gotten their good protection heading into the fall. If we look at the demographics, all of this is also available on our dashboard. The people who have gotten that updated fall 2022 vaccine, we see that 57% of them have been white, 17% have been black, 14% have been Latinx, 8% have been Asian. We see that women have been more likely to get a vaccine, 55%. And then over there on the left, we see children in particular very unlikely to have gotten the updated vaccine. And that's what I'm especially concerned about, as well as older Chicagoans. And if we flip it the other way and say among those who are eligible, not the percentages of the demographics of who's gotten it, but among who is eligible, who we have a record was vaccinated in the past. Ideally, these should all be 100%, because these are all people who have already chosen to get their primary vaccines. But still, we're at less than 15%, 5%, less than 15% of eligible Chicagoans have gotten that fall 2022 booster. And you can see by race ethnicity here, that's less than a quarter of white Chicagoans, less than 16% of Asian Chicagoans, less than 11% of black Chicagoans, and less than 8% of Latinx Chicagoans. And even on the right, on the bottom there by age group, we haven't even hit 30% of our most vulnerable group, those in their 60s, 70s, and 80s. So please, if you know someone who's older, if you know someone who's a child, or for everybody, getting that vaccine is critical. The combo you don't want is flu and COVID, so getting both vaccines is critical. On our influenza vaccine uptake, we're doing okay. These graphs are specifically in Chicago. The red shows you this flu season, 2022 to 2023 vaccine uptake, and the blue is last flu season. So higher is better, and you can see the red line is a little bit above the blue line. So we've given around 5,000 more doses of flu vaccine vaccines so far this season compared to last season, which is good. And these have been given by more than 2,200 providers across Chicago, just highlighting how many places there are to get flu and COVID vaccines in Chicago. That's pharmacies, doctors' offices, pop-up clinics, our at-home program, et cetera. I do want to note, though, that we continue to see flu vaccine uptake fall off for children, and I am worried about this. We've seen a drop-off in routine childhood vaccinations, but also in flu. So where on the prior slide we saw the red line for this flu season higher than the blue line, so far this year for kids under 18, the uptake has been lower. And I do want to note that if you go back and look at flu vaccine in pre-COVID, 2017 to 2018, almost 83% of kids 6 months to 4 years had their flu vaccine for that season. And by last year, we were down to just 72%, which is a big drop. And we're on track to be even lower than that. And flu hits kids hard. It's different than COVID. It tends to hit both young and old really hard. So we absolutely get children hospitalized with the flu. And really every year, we have Chicago children die from influenza. So getting your kids vaccinated for flu is critical. We see similar racial and ethnic disparities in flu vaccine uptake. This was last year. You can see that just over 60% of white Chicagoans estimated by the end of the year had a vaccine, and that compares to less than 30% of black Chicagoans. And that's part of why we see higher influenza hospitalizations for black Chicagoans. We see higher rates of pneumonia as a superinfection after flu. And so just continuing to try to make sure there's good convenience and availability. The health department has decided to extend, in partnership with city colleges, our Saturday vaccine clinics. These have been going really well. We do hundreds at every one. COVID vaccines, including boosters, and flu vaccines for all ages are available free of charge every Saturday. This Saturday will be at Malcolm X, and then you can see Truman, Kennedy King, Wright, Olive Harvey, and Daly continuing through mid-December. And we encourage you to register, but walk-ins are also welcome. Good opportunity to come up to date. And then the last thing I wanted to mention was we've gotten a lot of questions about these, some of the science, the preprints that came out this last week. So just to read a couple of questions that came in. We got a question from Terry, who said, I heard on the news that the updated bivalent COVID booster versus the second booster does not significantly increase immunity. Can you please comment on this? So here's a look at the science, and this will be a little bit of detail, but for those of you who are interested, I wanted to have a minute to explain how I'm thinking about this. So first of all, let me remind you about preprints. Preprints are studies that have not yet been peer-reviewed, meaning they are not yet published in a journal, and they've not yet necessarily had all the checks around them. So if you can check out this website if you want to see the preprints, and right on the top it says we post many COVID-19 related papers. A reminder that they have not been formally peer-reviewed, should not guide health-related behavior, and should not be reported in the press as conclusive. But there is a lot of interest, of course, in having very real-time data as it comes out. And so I just want to remind everybody to take these with a grain of salt. You are seeing science literally in real time here. I also want to point you to, if you don't know Caitlin Jettelina, she does this Your Local Epidemiologist site, and I think she does a really nice job following the science and looking at the breakdown. So I would refer you to yourlocalepidemiologist.substack.com as a nice source if you want to read about some of this. But I'm going to, using some of her information and other things I've read, I'm going to actually walk you through these two preprints and just overall the science of the fall 2022 boosters. So there are three things that we hope the updated fall 2022 COVID-19 boosters provide. Number one, we hope that they provide greater protection against infection and transmission by boosting our first line of defense. That's what's called neutralizing antibodies. We have some previous knowledge about this. I pointed to the preprint from September. We know that there were initial trials in mice and an early human trial that showed that the bivalent booster should enhance protection against Omicron specifically, because the updated booster has been made to to better recognize Omicron. So the hope is that we see greater protection against Omicron in transmission. Second, we hope that we see longer protection against infection and severe disease. We hope that that can extend by months. That can only be collected in real time, and it is being collected. So we'll know the answer in a few months, but given prior experience, and particularly the clinical trials done around the beta vaccine, we do expect that will be true. And then third, we hope that we will see broader protection, and I want to talk about that. It's the ability for our body to create antibodies that can see more virus parts. So if the spike changes, like we've seen in Omicron, it can better see and recognize Omicron and then be able to attach more strongly to the antibodies we have now. And so there is also previous knowledge on this part, and good. All of the pre-data on number 3 looks very good. So the previous knowledge, the question is, do we make new B cells, which are our body's antibody factories, in response to an updated vaccine? Do we update that factory line when we see another variant? And the answer to this does seem to be yes. There was a preprint from September 22, and again, I put the reference there if you want to go read the details. So this week, we had 2 new preprints that were published, October 24 and October 25. You see the titles and the lead authors there. And these were reported on quite widely in the press. So I thought I would just explain them a little bit. The Wang paper, which is the first one. These are both, by the way, they're out of reputable, sort of well-known labs. And the fact that they're coming out the same week, even though they're preprints and finding similar similar findings, suggests that this is real, that this is a true finding, that this likely will be published in a peer-reviewed paper in time. And so just to explain what these were, the Wang paper, for example, collected sera, which is blood basically, from 3 different groups of individuals. People who had gotten 3 or 4 doses of the original vaccines, meaning they got their first 2 mRNA vaccines, Pfizer, Moderna, and then they went on and got either a first or in some cases a second booster. So that was the first group, people who have stayed up to date before the vaccine. Then the second group was people who got the new bivalent vaccines as a 4th dose. So that means people that had had 1 prior booster, but then got the bivalent vaccine, the new fall 2022 vaccine. And then finally, individuals who had had a breakthrough infection following mRNA vaccination. So people who, especially before the vaccine was available, had COVID pretty recently with BA.4/5. So they looked at the blood from all of these, and they tested these people's sera or blood for neutralization. You do this by putting the blood in a little petri dish, and you see how many neutralizing antibodies were made. And that suggests the initial line of defense. They looked at the ancestral, meaning the original SARS strain. They looked at some different Omicron sublineages and then some other viruses. And so specifically, the reason these just are coming out now is this is 3 to 5 weeks post the booster shot. Like, people have just we're only now starting to be able to look at this in real time. And what they found was that individuals who received a 4th vaccine dose with a bivalent mRNA vaccine, meaning the updated vaccine, had similar neutralizing antibody titers as those who had gotten a 4th mRNA vaccine, and that was true for all of the subvariants tested. And so here, just to give you a sense of this, this is what the data looks like. Each of these is showing you against the different subtypes. The idea is higher is better in terms of the neutralizing antibodies. And over on the right there, you can see people that 3 shots, WT plus bivalent, those are the people who got the updated vaccine. And you basically see that their little bars there are the same height as the ones who had gotten 4 shots. And so the conclusion of the study was that when given as a 4th dose, a bivalent mRNA vaccine that targets Omicron did not induce superior neutralizing antibody responses in humans at the time tested compared to the original monovalent vaccine formulation. So in summary, it showed that neutralizing antibodies went up after the fall 2022 booster. We expected to see that, but it is good to see it in real time. the way that we report science, you're basically saying, is this inferior or non-inferior? And so the neutralizing antibodies were not higher after the fall 2022 booster compared to the original formula booster. And that is a little bit of a bummer. We would have hoped that you would see even higher neutralizing antibodies after the fall 2022 booster. But does this mean that the fall booster is not working? Absolutely not. The increase in neutralizing antibodies, that's what helps prevent infection and transmission in the short term. The old vaccine formula did this. The updated vaccine formula does this. This is not a surprise. This is actually good news, and this will help get us through the winter because you get that initial neutralizing antibody response, like for sure. But also, I want to highlight that the study time frame really matters, and if you read the papers, you'll understand this. So these studies checked people's blood 3 to 5 weeks after getting the fall booster because the fall booster's only been out for a couple of months. And so it's really focusing on the initial line of defense, what's called neutralizing antibodies. But we know from prior research that broader protection actually peaks about 2 months after getting that updated vaccine because neutralizing antibodies are not the whole story. The body needs time to make the updated B cells, the new antibody factories. So I know this is a lot of detail, but let me kind of talk you through this. So the very first time that we see a virus or we get a new vaccine, our immune system learns a lesson. It learns how to protect us, and specifically, it develops what are called B cells, and that's a picture of a B cell over on the right. The B cells are little antibody factories. The antibody factories, every time your body sees a threat again, the B cell pumps out a huge quantity of the antibodies that are what bind and protect. So when we next come into contact with the virus, or we get another vaccine, our immune system learns that lesson. Our immune system wants to rev up as fast as possible. So what happens first is that B cells start pumping out the antibodies of the shapes they've seen before, what's called B cell memory. And it's not until later that B cells update that factory line and start pumping out updated antibodies. And so I want to highlight that prior research shows that you get this factory update for COVID about 2 months after exposure. So if you have just been infected with a new strain of COVID-19, or you have had an updated vaccine, that happens about 2 months later. So the updated booster's benefit may be marginal in the beginning compared to others, but we expect it to be better over time. On the right here, this is a study. This one was published in Nature Medicine, so not just a preprint, but like one of the best journals. And it looked at neutralizing antibodies for a vaccine that was made specifically against the beta variant. And you can see here that that initial spike, the orange was the trial, the updated beta booster trial, and then the blue was the original COVID vaccine. And you see that initial spike, the orange and the blue both rise up pretty quickly, just like we see with the real world data for the fall 2022. In this case, the orange was just a little higher than the blue. It would have been nice to see that. But really the big difference here is that about 2 months later, that orange level is quite a bit higher than the blue level is. And that's what we're anticipating we'll see as a result of the fall 2022 vaccine. So to kind of sum this up, the 2 new preprints, they provide excellent real-time information. They're very good science, but they're also not the whole study. The whole story. They help us understand the short-term impact of the fall boosters. Basically, getting a fall 2022 booster is as good at prior formulations to boost the protection ahead of fall and winter, but not necessarily better. So this is real-world data as expected, that it boosts neutralized antibodies. That is critical to get us through the winter. It's why we need you to get vaccinated now. We already had real-world data showing that the fall boosters provide broader protection as these new B cell production is stimulated, and we do expect that that will provide more protection over the long term. Prior studies suggest that this longer term effect kicks in about 2 months after the updated booster. So watch this space. We will similarly see preprints emerge about 2 months or so, 2 to 3 months probably, of that real-time data, and we'll see if that hypothesis is true. But in the meantime, you should absolutely get your fall 2022 booster. Nothing about any study that has come out suggests that these vaccines do not work. Nothing suggests that they do not boost short-term protection, and nothing suggests that they are unlikely to give the better longer-term protection against Omicron. So do you need to get a COVID bivalent booster this fall? Are you 5 or older? If yes, have you gotten your original COVID vaccines? If yes, has it been 2 months or more since your last vaccine or booster? If yes, you should get the bivalent vaccine. So it is time. It's probably the last day I can show our Halloween messaging here. It is time to get your booster. So get that fall updated bivalent booster while it is available and still widely free at pharmacies, doctors' offices, pop-up clinics, standing clinics, or at home. And I do just want to thank our many community partners that have been doing fall festivals. You see just some examples here: Graduates Over Guns, Phalanx Family Services. We had a COVID-19 community household giveaway at New Covenant Harvest. Really thank our many partners who have been working to make sure COVID vaccines are available at pop-ups for people who may not be going out of their way to see their doctor or go to a pharmacy. So you're welcome to get it at a pop-up, but also there are more than 2,200 places around this city that will give it to you for free. And you can get your COVID vaccine and your fall vaccine, your flu vaccine at the same time if you would like to. So as always, chi.gov/COVIDvax for more information, or give us a call 7 days a week, 312-746-4835. And now I'm going to turn to your questions. Again, if you are joining us a little bit late, we were having some struggles with the Facebook, on the Facebook side. So we're streaming on Twitter, and we are, we'll come back, and if you have trouble getting your questions in, we will get them next week. Okay. So here are a number of questions. So Militia Christensen on Facebook says, I got both vaccines at the same time a few weeks ago. I felt like I got hit by a truck. So Melissa, I would guess, I have no idea who you are, but my guess is if you feel a lot of side effects after you get the vaccine, I would guess you are probably not very young and not very old, because where people have these sort of more robust short-term side effects, that basically tells me that you have a pretty robust immune system. So it is not fun when you are getting vaccines and having side effects. And I do encourage people, if you are really, those shorter term side effects, you can take Tylenol or ibuprofen. That will help. If you need to rest, that's fine. I've had, I get almost nothing in terms of side effects. I had my flu shot last week and didn't even really have a sore arm. If anything, a little bit of tenderness if I pushed on it. No other side effects. But I know especially people with robust immune systems sometimes can really feel it. So if you are someone who has previously had, you feel like you get hit by a truck, or you're really not feeling well, maybe you might be someone who doesn't want to get the vaccines at the exact same time. But for most people, it's very convenient to get the flu vaccine in one arm and the COVID vaccine in the other arm. And please do take some comfort in the fact that if you have a robust immune response, it means you've got a strong immune system. So you're also less likely to, statistically, you're less likely to get a breakthrough infection. You're less likely to get seriously ill if you do get COVID. But thanks for that comment, and thank you for getting vaccinated. All right, there's a question from Alexandria Deanne on Facebook. I think this one was perhaps from last week, but we'll hit it. So a friend of mine has had COVID for several days and just now lost his sense of smell. Is it common for that symptom to appear later in the course of an infection? I was under the impression that that really isn't a common symptom anymore. So let me talk about that loss of smell. That loss of smell is what we call pretty pathognomonic. That's like the medical term for COVID. That means that there are not very many things out there that make you lose your sense of smell. So if someone loses their sense of smell, we pretty much know that person has COVID. So it works that way, but it doesn't work the other way. Lots and lots of people who have COVID never lose their sense of smell. So if you lose your sense of smell, it's basically COVID. So it is still a symptom that we see. It's not necessarily the most common symptom, but especially if somebody's never had COVID, you absolutely can lose your sense of smell with Omicron, just like you can with all of the variants that have come before. And of course, people have a wide range of symptoms, from mild to severe. We typically we see symptoms appearing with Omicron, more quickly after exposure to the virus, often just 2, 3, 4 days later, as opposed to the 10 to 14 days that we were seeing at the beginning. But anyone can have mild to severe symptoms. There was one large study that found that actually only about 13 to 16% of patients lost their sense of smell and taste during the time that Omicron was dominant. That's much lower than the 44% or so who were losing their sense of smell or taste when the Delta variant dominated. So 13 to 16%, that's lower than it was, but it's also, more than 1 in 10 people. So if you want to read about that, the British Medical Journal in July had a really nice paper looking at the prognosis and persistence of smell and taste dysfunction in patients with COVID. They did a big meta-analysis. That's how we got data of how long, people do typically recover their sense of smell and taste, but it can take a while for it to come back. So yeah, right now I'd say the most recent data suggests about 13 to 16% of people right now getting COVID, getting Omicron COVID, are losing their sense of taste and smell. Okay. DS Shin on Facebook says, should adults be worried about RSV, and what other symptoms for adults? Okay, let's talk about RSV a little more. RSV stands for Respiratory Syncytial Virus. It's actually a very common virus, and most of the time it causes just cold-like symptoms. It's less likely to cause fevers or make people critically ill. But the challenge is that it can show up and create more severe symptoms, especially for young children. It is the leading cause and has long been the leading cause of hospitalization for pneumonia, or what we call bronchiolitis, which is inflammation of the lungs for children under 1. It's the virus that's most likely to put kids in the hospital, the really young children. And especially if children were born prematurely or have heart or lung problems, RSV can hit them especially hard. So we worry the most about RSV in the little ones, really children under 2, but especially under 5, or children who have underlying conditions. And I do want to note that for those children, if you have a child who was born prematurely or has an underlying heart or lung condition, talk to your doctor, because there is medication that we can give. It's an injection once a month that can help sort of during this season help build protection. But it's not for most kids. It's only for children born prematurely and at risk for more severe outcomes who are young. But talk to your pediatrician if you're wondering. Other than that, adults can get more seriously ill. Again, more likely to happen if they have underlying conditions, heart and lung. When I used to be a full-time doctor working in a hospital setting, every year we would sometimes see adults with heart failure or other underlying conditions sometimes get hospitalized with RSV. There is not a vaccine for RSV. There have been trials to try to develop a vaccine for RSV, but there's nothing that is currently approved or available. And so most of the time, RSV for kids and adults just shows up like a typical cold. But like always, any virus, especially in people with underlying conditions, can be more severe. So I would say RSV is especially spread through contact more. So I would be being extra careful with hand washing and hygiene. The germs can kind of spread when young children, especially, you're touching each other, you're touching your face. The germs do need to get into your respiratory system. So I don't think there's a major concern for adults for RSV, but it's just that right now, we are seeing all of these respiratory viruses circulating again. We went a couple of years with unusual patterns of disease where a lot of our children didn't see RSV, right, for 2 years, even 3 years. And so even some older children are just seeing it now for the first time. And just like every other disease, the first time you see a disease, your immune system, if there's no vaccine, your immune system has to learn how to fight that off, and you can get more seriously ill typically the first time that you see the virus. So symptoms usually cold-like symptoms, but if a child or an adult is having trouble breathing, is having trouble, seems like they're very lethargic or hard to wake up, has underlying conditions and just doesn't seem well, you need to call their doctor to talk about it. Or if it's those emergency kind of symptoms, kids or adults should go to the emergency department to get evaluated and then tested if appropriate. And okay, here's a follow-up from Melissa. Is there work being done to develop an RSV vaccine? There is. There was a trial of an RSV vaccine that in the 90s, they were quite hopeful was going to be successful, but it didn't end up really protecting the most vulnerable kids against the severe outcomes. And so it was not approved. It didn't come to market. There are a couple of RSV vaccines that are in later stages of, trials, but I don't anticipate anytime soon we will have an RSV vaccine. And this just, I think COVID, the whole world focused its laboratory and scientific researches. We poured billions of dollars in, and my goodness, the payoff, right? Within a year to have a fully studied, safe, and hugely effective COVID-19 vaccine, that's very unusual. Usually the way vaccines are funded in this country, it can take years and years and years. Pharmaceutical companies that are working to develop them, it costs, hundreds of millions, if not billions of dollars to do the science to make sure that a vaccine is safe and effective. So I'm hopeful we'll have more of an RSV vaccine down the line. But given that it is not life-threatening most of the time, it isn't as high a priority as the life-threatening viruses. And there is, like I said, there's this medicine, this infusion that can protect those at highest risk, the little ones. All right, Francie Swidler, and this was on Facebook. Are there new or more widely seen COVID symptoms that we should be aware of, especially as we approach the holidays and as new variants come about? So there's no new COVID symptoms that we're seeing. I shared that, for example, some of those more traditional loss of taste and smell are not showing up as often. More typically, especially in people who are up to date with vaccines, COVID is showing up like cold or flu. It's less likely to put you in the hospital. It's less likely to kill you. But especially in people who are not up to date with vaccines, I want to highlight that we still see plenty of Chicagoans getting seriously ill, needing to be hospitalized, needing to go on a ventilator, which is the machine to help you breathe, and then in some cases still dying. So no new symptoms, but the thing I keep saying is that we are all very tired of COVID, me most of all, but COVID is not tired of us. We see it continuing to mutate, working to escape our immune systems as much as possible, and the symptoms are similar, and it remains highly infectious. So, question from Jennifer. I got the bivalent booster and flu shot at a pop-up event that my alder did. Yay, agree, thank you. I didn't have my vaccination card with me. I walked up, I filled out the forms, I got the shot, but I didn't provide backup documentation. This is convenient, but seems weird. Do you have any concerns? I don't have concerns because all of your COVID vaccines, you get the handwritten card, but also your vaccine information is entered into the Illinois vaccine registry. So behind the scenes, when you're coming up to register, the nurses and the folks who are registering can check your vaccine history to make sure you've had prior vaccines, or if you haven't, or what you've had. That does live in a central location. That's why if you lose your vaccine card, we have information online for how you can go and download in a secure way the information about your vaccine records. So if you have lost your card, they will not go back and make you a card with all of the prior vaccine doses on it, but they will give you a card with this year's up-to-date vaccine. And then again, you can pull this documentation together. So that's why it doesn't worry me. And thank you for getting both your booster and your flu shot. And thank you to your aldermanic office for hosting a pop-up event. We did this. We made sure that every single aldermanic ward had an event and tried to co-sponsor it. We co-sponsored it with nearly all of the aldermen so that's another trusted place that prior to COVID, people would go get their flu shots. Well, this year we did flu and COVID shots. So thank you for that. John is asking, why isn't there a limit on how many COVID tests can be purchased? I saw a man in Walmart buy a cart full. So there's no limit on how many COVID tests can be purchased because we have plenty of availability of COVID tests. These, of course, are the at-home tests. Behind the scenes, CDPH is also stockpiling at-home COVID tests because if we were to see a major surge, we would want to make sure that people were able to get these. And my hope is, we never have to use them. We never see a surge, but that is something that we've spent federal funds on so that we have some capacity if the market kind of doesn't hold up in the case of a surge again. But there's a lot of information on our website about how to get a free COVID-19 test. I want to remind you that no matter what your insurance type is, there are free COVID tests available. It's just different in terms of how exactly that plays out. And if you're having trouble finding a free COVID test, you can give us a call, 312-746-4835, and we can help get you connected. But who knows if the cart full, perhaps he's buying those because he's hosting a conference here in Chicago. We see a lot of larger meetings and events continue to have people test in advance, and I think that's great. Given that people, as we know, can have mild COVID right now, but still be spreading it, and we're not using masks, offering free COVID tests ahead of a large event or a gathering can be another way to help keep folks safe. So let's assume the man in Walmart was using them for some kind of larger gathering, or maybe he was just stockpiling himself. And that's not something I'm concerned about. I want everybody to have at-home COVID-19 tests. That's what we want most people using because you can test, get diagnosed, and act on that right away. All right, another question. Do you think there's a lot more COVID cases right now because more people test at home? Are those included or reported to the Chicago dashboard in any way? So yes, because more people are testing at home, we have never counted every COVID-19 case, just to make sure you hear that. We have counted every COVID-19 case that is done in a laboratory or done through a physician's office. Those by law are reportable and they come in a way that protects privacy, but it's that data that lets us compare test results to, in individuals, to vaccine records in individuals, to understand what our breakthrough rates are, to see how well people are being protected after an infection. What does that timing look like? How long is it between reinfections? So it is all kept track of when you are tested in a formal setting. But since at-home tests have been available, we know that we don't capture the majority of tests, but we don't need to understand how COVID is doing overall. We have more than 100 years of experience with tracking flu and other diseases. We don't count every case of flu either. We have ways to do estimates. We have ways to understand who's coming into emergency departments, who's coming into hospitals, who's coming to the ICU, who's dying. Those are reportable in the same way. And then we test, for example, a sample of where tests are being done. We look to see, are these flu? Are these COVID? Are there variants emerging? What strains of flu? So there's a lot of behind the scenes work that happens through our team in Chicago to make sure we're keeping track of COVID levels. We also now have things like wastewater in place that let us, at a population level that is not dependent on individuals' testing behavior, get a sense of how we are doing with COVID. So one of the reasons that I'm pleased, because we are still at a overall, there's sort of a low, medium, and high level for wastewater, and we are still at a relative low level for wastewater. So these are all different ways that we have of following. So please don't think that we need to count every single case to understand how we're doing from a COVID perspective. But we know that cases, when you see cases in the formal setting tick up, you know that they are ticking up at a much higher rate even for people getting tested at home. But I love people testing at home. That's how I diagnosed my COVID. I did not go in and get a follow-up test. I diagnosed at home and I acted on that. Any positive COVID test, you need to stay home for a minimum of 5 days. And then if you're feeling better after 5 days, you can be out, but you must wear a mask days 6 through 10. That hasn't changed. I don't anticipate that changing anytime soon unless we see the virus behaving with different timelines or in new ways. Lisa says, I want to make sure I'm protected against COVID in time for Thanksgiving with my family. When's the best time to get the updated fall vaccine? So I would get your updated fall vaccine right now. And I would get your updated COVID fall vaccine, and I would get your flu vaccine really right now. And that's because a couple of things. Number one, it takes about 2 weeks for those initial antibodies to sort of fully kick in, meaning you probably have the greatest immediate protection in about 2 weeks after you get an updated vaccine, or after you get any vaccine. But based on some of the science I was showing you earlier, it's about 2 months later that we anticipate that your immune system has entirely learned the lesson, created those B cells that can more quickly fight off, the infection that might be coming down the line, particularly with Omicron. And so I don't think there's a lot to be gained from trying to kind of game the timing of your vaccine. The thing I worry about is people waiting too long. They say, oh, I want to wait until the surge is fully here, or I want to wait because I'm going on a vacation in January. It can very easily, you can miss that window quickly if you're waiting and we're in a surge, you're more likely, frankly, to get COVID while you were waiting to time your COVID vaccine. So I really, truly, I can tell you from my standpoint, I wanted to make sure that I got my flu vaccine in September or October, which I did. And I would have already gotten my COVID-19 fall vaccine, except that I relatively recently had COVID. I'll just remind you that I recovered from COVID in late August. The CDC says if you've recently recovered from COVID, you don't have to wait, and people who are immunocompromised or on cancer treatment or are getting advised by their doctor, you can get that booster sooner, but you can wait about 3 months. And so I am planning to wait about 3 months, and I will be getting my COVID booster in November. I will get it ahead of Thanksgiving. But that's just because I recently had COVID. If I had not had COVID recently, I would have already gotten my COVID-19 booster because I want that protection ahead of the fall and winter. There's no such thing, based on everything we see now, as getting it too early. There is absolutely such a thing as getting it too late. So now is a great time to get it ahead of Thanksgiving and ahead of Christmas. And if you are someone who's been extremely careful and you want your antibodies to be as high as they possibly can be, and you want to time it around a date, it's got to be at least 2 weeks before that date. But really, I wouldn't try to game it like that. I would just go ahead and get it now. Good question. All right. I think this is the last one we'll take. This is a good question. Caitlin says, are you worried with all of these new subvariants of Omicron that the new vaccine will not protect against those? Wasn't it only designed to protect against BA4 and 5? Caitlin, that is a beautiful question. So I think everybody is a little worried about how quickly we are seeing Omicron subvariants continue to emerge. And my official answer to that is I don't know for sure what is going to happen with variants. I would be much more worried if we saw a new variant of concern emerge. Let me just remind you about the 3 levels of variants, because I know you all don't think about this as much as I do. So when a new variant or subvariant emerges and we're like, that's interesting, let's watch it, it's literally called a variant of interest. Okay, so we will have variants emerge. They are variants of interest. We monitor them. Anytime you see a new variant of interest emerging, it means in some way it is outcompeting the predominant variant. So something about it, the spike is a little better at infecting. It's a little better at potentially evading a vaccine. It's making people sicker. Whatever it is, it's a variant of interest. The next level is when I really worry. That is when WHO, CDC, everybody gets together and says, this is a variant of concern. A variant of concern doesn't just mean Omicron subvariant BA4, BA5, BQ, BF. It gets the new letter in the Greek alphabet. So the original, the first, we named it Alpha. There was a Beta, there was a Delta, there was there was an Omicron. Each of those were named a variant of concern because they were highly concerning. They were behaving in a way that was different from what we had seen previously. They were causing significant surges, and most importantly, they were able to evade immunity in some way. So Omicron was the biggest example of that. When it emerged, that was the worst surge we've had. That was last winter, and the way the spikes had changed, et cetera, that was the first time we started seriously seeing a lot of breakthrough infections. People who had previously had vaccine still able to get COVID. We hadn't seen that very much prior to Omicron, but Omicron was really different. So it was a variant of concern, and it's part of why there was a decision made to make the updated booster ahead of this fall and winter. So it would be wrong for me to say I'm not worried at all about what's coming. But the good news is, based on some of that science I was showing you, when you teach your immune system, this is the first updated vaccine, when we teach it to better fight off BA4 and BA5, it's not like it's just fighting off BA4 and BA5. It's fighting off all of the changes that have happened to the COVID virus to make that BA4 or 5 variant. So maybe I'll show this next time that we're on, because there's interesting science in this. But like, what makes something be BA4 is that there's been a little genetic mutation that makes this spike do this. There's been a little genetic mutation that makes this shape do this. There's been a little genetic mutation that makes this do this. So the naming overall is a whole list of, 30 or 35 mutations compared to the original. And so when you get the updated booster, it's not like it's just for BA4 or BA5. It's for all of those 30 or so changes in the virus. And prior history with COVID shows us that new subvariants keep doing little adaptations on what has come. And so I predict, I don't know for sure, but I predict that now that we know, based on the preprint, we know you get broader protection after you have the COVID-19 fall 2022 booster. That means your body is better at recognizing all of the different changes that make BA4-5. And so the prediction is that those would also be more protective against whatever is coming next, because whatever is coming next is likely to build on the changes that we've already seen through Alpha and Beta and Delta and Omicron, including BA4-5. So that's a really good question. And if you were watching this whole thing, go back and look a little bit at that part I was talking about with the B cells, that your B cells is what your body makes to churn out the antibodies, which is what fight off. And the updated vaccine helps you make new B cells to better fight off the versions of Omicron. So I think the last note I'll say is that a question I get a lot just in my life right now is there anybody left in Chicago who has not had COVID? Yes, there are actually lots of people left who have not had COVID, believe it or not. But what is not left, there are no people in Chicago, I would say, or very few, but way less than 1%. There much fewer than 1% of Chicagoans left who have not had COVID and who have not stayed up to date with COVID vaccines. We still see people out there who have done a good job staying up to date with COVID vaccines and have not had COVID. And to those people especially, keep staying up to date. But for the rest of you, even if you've had COVID, the vaccines matter. Even before we had the updated vaccine in the fall, we see that people who have stayed up to date with their vaccines just in 2022 in Chicago, regardless of whether you've had COVID before, regardless of everything else, 6 times less likely to die from COVID as opposed to those who are unvaccinated. And it's not just getting the original vaccine is still the most important thing, but getting this fall 2022 booster truly is your best chance at protecting yourself and your family against what is coming this fall and winter. It's really, the goal is looking ahead, not back. And so I don't care if you ever had a booster in the past or not, you should get this booster vaccine this fall. So thank you very much for your questions. Apologies for some of those technical difficulties at the beginning. We will not be on next week, November 8th. I'm actually going to be in Boston for the American Public Health Association conference. It's the 150th anniversary. But we will be back again on Tuesday, November 15th at our regular time, 11 a.m. And in the meantime, if you put questions in, if you email them in, if you put them on Facebook, if you put them on Twitter, we do keep track track of them. We use them to update our website, and then we'll pull some of them to address live. So thank you very much for your attention and your interest, and we will see you back in a couple of weeks. In the meantime, come up to date with your vaccines and stay safe.